A new NBC report is looking at the high cost of prescription drugs right here in the U.S. and what essentially is being done to make them more affordable. Top health officials say the key to lowering prices is getting Americans to take fewer medications. Dr. Mehmet Oz, the administrator of the Centers for Medicare and Medicaid Services, spoke about this strategy at a White House event earlier this month.
It is your patriotic duty. I'll say it again, the patriotic duty of all Americans to take care of themselves, because it's important for serving in the military, but it's also important because healthy people don't consume health care resources. The best way to reduce drug spending is to use less drugs because you don't need them because you're healthy.
All right, NBC News health and medical reporter Berkeley Lovelace Jr. joins me with more. We heard Dr. Oz there essentially saying, like, it's patriotic, just take fewer drugs. But why do most health professionals say that that is not the solution?
Hey, yeah, so it's definitely not an unreasonable approach. So people eating better and exercising would likely reduce overall healthcare costs. But the proposal really misses on two key areas. One, many people in the U.S. rely on prescription drugs for conditions that have nothing to do with their lifestyle choices. So that includes things like type 1 diabetes, asthma, and certain cancers. They're going to need medications. Two, it ignores the fact that the United States has the highest drug prices in the world. So the U.S. spends trillions of dollars each year on healthcare, including on drugs. So regardless if a person is healthy or sick, one day they're going to get sick and going to need medications, Morgan.
You know, why are prescription drug prices in the U.S. so high? Like just kind of set the scene from the beginning for us.
Yeah, it's something that comes up a lot. So without going into the insurance side of it, many other countries have drug pricing in place that prevents these drug prices from going too high. In the U.S., though, there have really been no guardrails for this. Just in January, for example, drug makers raised the net prices of 963 brand name drugs. And other administrations have tried to do something about this. The Biden administration and Congress, for example, passed the Inflation Reduction Act, which lowered the out-of-pocket cost of insulin to $35. Something I'm watching, Morgan, is whether the Trump administration will support Medicare drug pricing negotiation, which also came under the Biden administration. So it's unclear whether or not they're going to ramp up or scale back those negotiations.
All right, Berkeley Lovelace Jr. for us there, Berkeley. We appreciate it.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.